Afternoon, everyone, and thank you so much for joining us. It's so wonderful to see our executive directors joining us for this very special event that we do. We typically do this event at our conference every year, but we've decided we'd like to also do an exclusive ED meeting during Children's Mental Health Awareness. And if this goes well, this will also become an annual event. So thank you for being with us. I'm Linda Gargan. I think I have met all of you, but if there's someone brand new that I haven't met yet, welcome to our family. I am the executive director here at the National Federation. And what I'm going to ask you to do is a couple of things. You've seen the agenda. And you know, we have a packed afternoon. We have some wonderful things happening and a variety of things that I think you are going to find very interesting, some entertaining, and very informative. So I'm going to ask you to just sit back and relax and enjoy this afternoon, which has been especially prepared for you. Now, we have a chat box, and I'm going to invite you to please introduce yourselves so we all know who's here with us today. And as we begin this first session, please use the chat box for comments or questions. We will do our best to get to all of those. So with that, I am going to turn this over to our first presenters. Now, as you've seen the agenda, we've set this up with some legislative information, some leadership information. We have a thoughts section, and then we'll have our ED meeting. So to begin this, we are so lucky to have our great friends from Mental Health America. Mary Giliberti and Karen Howard will be joining us. And I think the best way to introduce them is to let them do that themselves, because they have wonderful things that they can share that I might miss. So Mary, I will turn this over to you.
Great, thank you, Linda. I'm Mary Giliberti. I'm the Executive Vice President of Policy for Mental Health America, and I am so delighted to be joining the Federation of Families today for this webinar. I had the privilege almost 20 years ago now of working extensively with the Federation on the issue of custody relinquishment. And we worked on state statutes and we worked to get federal laws done. And I have just a great appreciation for what incredible advocates you all are and how you bring the voices of families and youth to legislators. And that is so important because that's what MHA tries to do too, to bring that lived experience. And we too have affiliates throughout the country, over 200 affiliates. I'm sure many of you work with our affiliates, and we're just really excited to join you today. And I'll let my colleague Karen Howard introduce herself as well.
Hi, everyone. I'm Karen Howard, the Director of Policy and Advocacy at Mental Health America. And I really enjoy speaking about the issues being discussed at the national and state level, because there are a lot of people who they need their voices kind of amplified. And my background really has been political campaigns and legislative work. My previous experience working on Capitol Hill and with members of Congress on the political side really, you know, made me interested in the career path, and realizing that there are so many people who were going without mental health care that was needed. However, it was just so easy to get physical care, made me want to kind of stay in this field. So I look forward to, you know, sharing with you. And if you all have questions at the end, I believe we do have time for questions. And I think Mary will kick us off with a really great first slide. And I'd just like to say hello to all the MHA affiliates out there. I see some from North Dakota, so that's really cool to see the MHA family and the Federation family all here today.
Great. First slide. And like Karen, I also worked on Capitol Hill, and some of you may know me, I worked at NAMI previously. I saw some NAMI chapters here too. So one big family, all these organizations working together to get things done for mental health, which is great. So I'm going to start us off, and I'm going to talk about where we are with respect to money. Show me the money, right? We have 3 bills that have already appropriated quite a bit of funding and several to go. After I finish some of the information about grant funding, I'm going to talk a little bit about Medicaid, and then we're going to get into some of the other topics that might interest you, things like telehealth, equity, parity. So we have a full list to discuss today, and we're really excited and look forward to your questions. So 3 bills down, several to go. So what's been passed already? The Coronavirus Relief and Economic Security Act, we like to call it the CARES Act, that's a lot simpler, was passed last spring. In December, we had what's known as the Consolidated Appropriations Act. That had the annual appropriations for fiscal year 21, plus a COVID relief package. And then just this past month of March, we had the American Rescue Plan Act. And that too was a COVID relief package allocating quite a bit of funding. What's coming in the future? FY 2022 appropriations, we get those every year, right? So we're going to be up there asking for our fair share again. And you probably have heard on the news, the American Families Plan, the American Jobs Plan, infrastructure. Who knows what that's going to look like, but we expect that there'll be some legislation there. Next slide. So what dollars are out there already? And this is really important for all of our chapters to start looking at dollars that are coming down. We use your voices and we've raised the need up to the federal level, and now some money is coming back down. So block grants, very large, appropriations there, 1.65 billion with half to states and half to community mental health centers. And in March, another 1.5 billion. And those kind of numbers are in both the community mental health block grant and the substance abuse prevention and treatment block grants. Now, we should just take a minute as the mental health community to be pretty excited that there is a B there, because typically in mental health, we know we have needs in the billions, but we wind up getting pennies really, usually. So to get up into those levels really indicates the advocacy that all of you did. And so that's exciting. And I urge all of you to get in contact with your state mental health authorities, because they're going to have this money coming down and be looking for how they're going to spend it. Education dollars. I know a lot of you all do education work. There are billions of dollars coming to state education offices and local education authorities. Now that money typically is mental health is one of a whole array of things they can do. You know, when they tell you can do any one of 5 things with your money, and you have no idea which one they're going to pick. That's the way this is written. So mental health is one of many uses. So we have to raise our voices to make sure that some of that money goes into mental health. And then there are a lot of smaller grants. Some of you might work on Project Aware, which is mental health in schools. That is designated for schools and mental health. That money, there was money for that program in these bills. National Child Traumatic Stress Network, suicide prevention grants, a lot of these smaller grants that people can think about. Next slide, please. So we have the president's skinny budget. And what does that mean? Why do they call it a skinny budget? It's just the skeleton. And we're going to see a lot more, probably late May, early June. But what did we see in the early budget that's relevant to mental health? We saw 1.6 billion in annual appropriations for the block grant. That's double, approximately double what it is today. That's a good increase. Secondly, 10.7 billion for the opioid use disorder program, and 1 billion in brand new resources for school mental health professionals. That's school counselors, psychologists, just broadly it says school mental health professionals. That's new money. As you might remember, the president promised to double those folks in schools. So he's beginning to fulfill that promise, and we're going to try to work hard to hold him to it. Next slide, please. MHA has done a question and answer document on relief funds. So you're going to have these slides. You can click on that. It gives you strategies for finding out about opportunities in your state and much more details and links to documents that really detail all of these grants that I've been talking about. So much more information there if you're interested in the details. So Medicaid opportunities, we know Medicaid is a huge funder of mental health services, right? And so a lot of the things that were in the previous bills are options. And that's really important because an option means your state has a choice. They can do it or they cannot. And the difference there is going to be advocacy. So states that have not expanded Medicaid, I know many of you have been working that really hard, there's a carrot in there. Mobile crisis services. Now this is very important in all of our states, and I know children's mobile crisis is really, a huge need in virtually every state. So there, the federal government is going to give an 85% federal matching percentage. What does that mean? What's an FMAP? That's the way we a little acronym. That is the amount that the feds are going to pay versus the state. So for every dollar spent on these services, the feds would pick up 85% and the state picks up 15%. So that's a pretty good deal, right? But your state has to choose that option. There's $15 million in there for planning grants. So you want your state to get some planning money and get started figuring out how they're going to better serve children with mobile crisis. So that option is already out there. It's for the taking. Postpartum individuals up to 12 months coverage. So you can cover people for 12 months, an additional 10% FMAP for home and community-based services, and that's for a 1-year period. Next slide, please. Medicaid opportunities to come. So that's what we've had. What are we going to have in the future? So President Biden has proposed spending $400 billion on home and community-based services, but we really have very few details about what that's going to look like. There's been some language about extending a program called Money Follows the Person, some discussions of increasing wages of caregivers and others, but not a lot of details. Representative Dingell and Senators Casey and Hassan released a discussion draft of a bill that's called the Home and Community-Based Services for All bill. And that provided 100% FMAP for home and community-based services, including mental health services. They asked for some comments on that. We haven't seen legislation introduced yet, but we think that's going to be coming. Lots of proposals and discussions about boosting that federal matching percentage, whether it be for children's services, children's behavioral health. We haven't seen legislation yet. In the past years, there has been some on behavioral health, but not yet in this Congress, but we expect that there will be. Next slide. Here, I'm going to turn it over to Karen here, and she's going to cover some more topics for you.
So as you all heard from Mary, there have been a lot of changes, and we're doing our best to keep people informed about what's coming down the pike. In terms of peer support, our approach really has been to start small but aim big. So with this Congress, we were really happy to see that Representative Judy Chu from California continues to make mental health and peer support a priority of hers. And she sits on the Ways and Means Committee. So that's important because of on the House side, Ways and Means Committee actually has jurisdiction over Medicare and Medicaid. And we know that commercial insurance and other health plans typically follow behind what Medicare reimburses for and covers. So getting something covered by Medicare is really a strategy for influencing the rest of the healthcare industry. One of the bills that we're, excited to see introduced or reintroduce this this session is the Peers in Medicare Act. It's HR 2767, and it's introduced by Representative Chu from California, as well as Representative Adrian Smith from Nebraska. And we were able to get this bill introduced as a bipartisan bill because of our affiliates on the ground. So thanks to the work of you all. We're really excited that mental health continues to be a bipartisan issue, especially in the House. And we're still working on getting some kind of collaboration done in the Senate. However, what this bill would do is for the first time establish a definition of peer support specialist in Medicare statute. And it would also clarify that Medicare providers or any, physician who is billing Medicare could do so and bill for peer support as part of integrated care that they're providing to patients. If you would go back just for 1 minute, the really exciting thing about the PEERS Act, that in addition to it being bipartisan, is that once this bill passes, fingers crossed, then the next step would be, okay, once PEERS services are covered within integrated care, how can we more broadly get PEERS covered across Medicare? And a lot of people are saying Medicare for all, and while MHA is certainly in favor of universal healthcare coverage, there are some issues with Medicare and parity. And so it's, our job, and what we're doing is educating legislators about the holes in Medicare that PEERS can help fill, and the gaps to how people are getting their mental health care. And so some of those gaps need to be closed in Medicare. Another bill that we were excited about that was first introduced last year is the Virtual Peer Support Act, which was introduced by Senator Cortez Masto from Nevada. Yay to any Nevada affiliates and chapters. Senator Cortez Masto has been a champion because she's been working across the aisle, and this bill in particular would provide grants through SAMHSA to behavioral health organizations that are providing peer support to help them with going virtual to facilitate distancing, to help them even with setting up broadband or getting equipment to help with that virtual transition. And not only and so those funds could be used for kind of administrative or technical things, as well as ensuring that peers could be properly reimbursed. So those are two things that we really like to see, and we hope that SAMHSA, under this new administration, also continues to grow its focus on more upstream services that can be provided, because right now most of the block grant funding that comes from SAMHSA to the states are really going to more kind of crisis services or later stage support that's very much needed. But we would like to see some additional funding, and again, 3 cheers for all the funding from COVID relief that has gotten SAMHSA funding into the billions. But we think that more of that funding, and we're advocating for more of that funding to go towards upstream services, and peer support we know helps keep people out of hospitals and engaged in care. With respect to telehealth, everyone realized how important, and even with our virtual meeting today, broadband and internet access is really, really important. The COVID relief bill that passed in December was an appropriations bill that allowed Medicare billing from home, and after the public health emergency, this home visits or home kind of telehealth could continue to be reimbursed as long as there was an in-person visit within 6 months of the first televisit. We're actually advocating to remove that in-person component, and we're making some progress. However, we'll see if kind of, other voices in the conversation can get on board with behavioral health being somewhat different from, getting checked up for a physical condition or something that really might need an in-person inspection, whereas we know behavioral health can really be truly treated and supported through telehealth and even audio-only services. We're also asking during conversations with legislators to expand Medicare coverage of audio-only services. Right now, there is some concern that audio-only might be abused by bad actors. But for people who don't have internet services, broadband, or access to smartphones, there is some challenge to being able to have that video component required in telehealth. And so for people who might be homeless or otherwise have limited access to broadband and smartphones, we think audio only is a really, really good alternative. So we're supporting the Mental Health Improvement Act, as well as the Permanency for Audio Only Telehealth Act. You only see the bill number by one of those bills because the second one hasn't yet been reintroduced this Congress, but we're really pushing and hoping for it too. So if you would do some advocacy on that, we would love to, you know, kind of share in that effort and really bring that groundswell of grassroots support into Washington on those two issues that, you know, will really make a big difference beyond the public health emergency. And in terms of equity, MHA is pushing, and we have a Hill Day coming up that we'd love for you all to participate in. I don't know if you also have your own Hill Days scheduled during May is Mental Health Month or other times throughout the year back in the States. But there are two bills in Congress that we're really paying attention to and pushing and trying to get you know, movement on. The first one is focused on maternal health, and the Black Maternal Health Momnibus includes a provision called the Moms Matter Act, which is kind of a separate bill. And the Momnibus is like a term that people use, or omnibus is a term that people use when they're kind of collaborating a whole lot of bills together. Momnibus obviously puts a spin on that, and it's really cool. It was introduced by Congresswoman Lauren Underwood from Illinois, and she actually is one of the co-chairs of the Black Maternal Health Caucus, and has, with her background in healthcare, she has certainly included the importance of providing new moms or expecting moms with mental health care. So to address some of the disparities, the bill would you know, create a task force and invest in research and workforce issues so that Black moms have access to some of the care that they need for mental health. Additionally, we saw, as Mary mentioned, that Medicaid was expanded in the last COVID relief package, and covering moms up to age 1 year after birth on healthcare makes a huge difference in outcomes in the long run. And we think that will help low-income moms, which happen to be Black and Latino more often than white. So we know that there's an equity issue there too. And then finally, kind of moving upstream to children, the Pursuing Equity in Mental Health Act is a bill that was introduced by Congresswoman Bonnie Watson Coleman after a year-long study done by the task force that she created, the Congressional Black Caucus Emergency Task Force on Youth Suicide, Black Youth Suicide. And that was created because research was showing that rates of suicide were increasing much faster in Black youth than they were in any other ethnicity or race. And so what this bill does is invest in closing research gaps between what works intervention-wise or what is happening in terms of prevalence in different racial populations and racial groups, especially in young people. It's also designed to improve the cultural competency of health professionals, peers, and community health workers who are oftentimes working with young people. And we know that there, you know, is a lot of implicit bias that ends up harming Black youth and Black and people of color who are seeking services. And then it also funds more outreach and community engagement. There's also a similar bill introduced by Congresswoman Grace Napolitano, which would create a fund at SAMHSA to increase outreach and community engagement to Latino communities in particular. And then additional funding, like we said, for research at National Institute on Minority Health. We really appreciate people who have reached out so far asking for MHA's kind of stances and how we're working on improving equity and moving towards a more equitable healthcare system. MHA has set its sights really high, and we're excited to see that some committees in the House and Senate are also thinking about these issues and coming up with solutions through conversation and roundtables and even hearings. If you all have time to weigh in, you can check in on some of these hearings that are happening at senate.gov or house.gov, and send your remarks along or send comments along. Send a, even if it's a letter that says this issue is important and we need to do something about it. Those letters really go a long way in pushing who's inside Washington to do the will of who's outside of Washington. And I will let Mary take over for some of the crisis care issues that are happening.
Sure. So we have a new 988 number, and I'm sure many of you are familiar with this. I've been doing this so long, and if you asked me today to give you the suicide hotline, I could not do it. I wish I could, but I couldn't. So we had, in October, Congress passed a law designating 988 as the new number. It'll be fully implemented by July of 2022. So we have a little bit of time, but not much. And we need additional funding for all of the pieces of this. I talked about mobile crisis and how important that is for youth. And given the increases, MHA has a screening website, and people come to our website and they screen for all kinds of mental health conditions. We have seen such a rise in 11 to 17-year-olds, and we've seen among that population just increased suicidality. So really important to have this new line up and running to help youth. Funding areas that are particularly important, the Lifeline Operations, that's an MHA affiliate. Vibrant Emotional Health runs the overall Lifeline, does the operations. They will need additional funding to deal with the new line. We expect they're going to get many more calls with a shorter 988 number. Local call centers. So in all of your areas, there are local call centers, but they currently don't get any federal funding. So we're really looking at how can we get that into the new infrastructure bill, into appropriations. Where can we get those kinds of resources? Mobile crisis response, we talked about that Medicaid option earlier, but we know even that's not going to be enough, right? So many states are looking at a fee legislation at the state level that allows the fee to go on your phone bill. And that's happening. Many of you have probably been working on those statutes, but we're also looking at the federal level. What else can we do? There are some grant programs out there, other ideas to get mobile crisis fully funded. And you'll recall I mentioned the $15 million in planning grants for that option. We'd really like to see states take that up and start thinking about this. And coordination at SAMHSA. So we know this is going to be a massive undertaking, and we want SAMHSA to have the resources to be able to coordinate all of this for youth and for adults. So we've been working to seek an appropriations for SAMHSA to have a coordinating center. So all those different pieces will hopefully come together and get us a really much better system for responding to people when they call. Many of those calls will resolve the issue right there, but then there's a percentage where there will need to be a mobile crisis response. And we've been working so hard to make sure that that response is a mental health response and not a law enforcement response. Because we have seen what happens when law enforcement gets involved in these, particularly around youth, really terrible outcomes for people. This is a major equity issue and something that we've been very focused on, talking about how a mental health crisis needs a mental health response. Next slide. Parity enforcement. I know that many of you have been working on this for years, as I have, trying to get equal coverage in insurance plans for mental health and physical health. Wouldn't think it would be so hard, but it has been decades that we've been working toward this. The December COVID bill had some provisions that increased transparency, increased the requirements for analyses of non-quantitative treatment limits. That is a mouthful. NQTLs, but what it really means is the things that you and I see all the time when you work with families, which is it's how insurance companies decide that you no longer need any care, even when you desperately need that care. So those kind of determinations, those medical necessity determinations, that's an NQTL. Prior authorizations requiring us to get prior auth when they don't always require anybody else to get prior auth. Those kinds of things, and the analysis has to be done on how they do that on the physical health side and the mental health side. That has to be supplied to any state entity authority that asks for it and the Department of Labor when that's requested. DOL is required to request 20 of those, and then if the insurance company doesn't make changes in accordance with that analysis, once DOL gives them feedback, they have to report to Congress. So that is a little bit more of a stick than we've had before, that they would get reported if they don't clean up their ways. The Parity Enforcement Act, HR 1364, would be an even bigger stick. It would allow the Department of Labor to impose civil monetary penalties. We already do that with HIPAA, with the Genetic Non-Discrimination Act. So there are other bills that have these in it, but Parity never did. So this would make it so that Parity is kind of on the par with some of these other statutes and allow the Department of Labor to kind of use that much bigger stick to get compliance. So we're hoping, and we'll keep working on that. Next slide. And we have there our contact information for Karen and me. We're happy to follow up and answer questions. Really excited to have had this time to chat about these things with you. And we have plenty of time for questions, things that you would like us to follow up on.
Thank you, Mary and Karen, so much for getting us right into the meat of things that we in the advocacy community need to be thinking about. We have several questions in the chat box that I'm going to go through, and I would encourage and invite all of you to add your questions to the chat box. I'm going to ask one question to get us started. I'm going to just take a minute for a question I want answered. With equity, we see much about equity in terms of racial and ethnic equity, which is so incredibly important. But I'm also wondering if we're seeing anything about equity in terms of our very rural communities, which have been so hard hit, and we know how under-resourced they are. Is there anything coming up in any of the legislation that you're aware of?
So with equity, we're finding that there is certainly an interest and urgency to address healthcare structural issues and structural racism throughout, education, justice, and all of our systems. If there's something it's interesting because we see legislation being introduced that advances equity, as well as legislation being introduced that would kind of detract from equities. So we're doing as much as we can to educate, address, label, and speak about what is happening, and promote the stories of people who have experienced individual bias and racism, as well as how people and populations have been impacted. You all may be aware that MHA's biggest program is an online screening program, and the 2020 data shows that people who were mixed race or non-white, though they screened more often last year than white screeners, which was a huge change in the population that would typically come to MHA's website. So there are stories and people are reaching out and asking, seeking help.
Linda, in the COVID relief package, there was provider relief funds. Specifically, the addition to that was for rural providers, interestingly enough. So Congress did add to the provider relief fund specifically for rural providers. And of course, I think it was mentioned in the chat, the telehealth bills, there's been tremendous conversation about equity within those, and that equity conversation has been both about racial justice and about rural issues and the and broadband too. I should have mentioned that as part of the infrastructure bill, there is a massive effort to improve broadband, and that the conversation there is around equity, both in the rural aspect of that and then also in the racial aspect of that.
So very, very needed. And just one more question to go along with that. Are there particular folks in Congress that you believe are pivotal in terms of our advocacy? I know different people are sponsoring different bills, but I know we have some major allies in both the House and the Senate. Could you tell us who those folks are?
Sure. So I would, start by looking up the Congressional Mental Health Caucus. Congresswoman Grace Napolitano from California and Congressman John Katko from New York have made it a priority that their portfolio, includes mental health all the time. I think there are different kind of champions per state as well. In the Senate, I would say that Senator Cassidy from Louisiana is a big champion of mental health and integrated care and some of our issues. And as well as Senator Murphy from Connecticut. Connecticut. And we are hoping that there's actually a joining of those two senators to soon form a Senate Mental Health Caucus, which has been disbanded or just kind of not really organized since the 1990s. So those people will always be willing to talk mental health issues with you. There are also many other champions. And I would say per state, there's probably one or two, if not in your state, then right next door, there's usually someone. Fitzpatrick in Pennsylvania, Tonko in New York, maybe in a rural state like, or more rural Minnesota, there's Tina Smith, who, has personal lived experience. Actually, in New Mexico, Senator Ben Ray Lujan, who has a track record of introducing peer support legislation in the House and has also reintroduced legislation in the Senate that's even more broad on peer support. So there are a lot of people who are speaking up for our issues and taking a stand. It's really upon us to push them and ask them and continue to follow up with their staff to ask them to take action. Mary, would you have any other folks to add to that list?
I think Senator Cortez Masto has been very interested in mental health issues. Debbie Stabenow and Senator Blunt have combined together to support the CCBHCs, the Certified Community Behavioral Health Centers, and that has been very helpful. As Karen mentioned, Senator Smith, and she's got a school mental health bill that will provide some grants for school mental health that's really useful. I also think that, your own congressperson and senators are probably the ones that are most going to be interested in what you have to say, and you would be surprised. You can find a connection. We found, people that folks said, oh, they don't, they're not going to be interested. And guess what? They were very interested. So I have found that you can, whether they're interested in education or they're interested in, any kind of issues, we have a mental health aspect to that. whatever it is, housing, there's always a mental health aspect. So, so it really gives you a chance to get out there and talk to your legislators.
Those are all great suggestions. Thank you so much. And it's so good to hear that we're developing those kinds of allies. That's wonderful. So we have some questions. The first is from Lisa Lambert. Does any of the money coming to states have language steering some percentage towards children, youth, and families?
I am not aware of anything within the block grants, for example, that allocates a percentage to children and youth. There is in a substance use block grant, there's standing language that says at least 20% has to be used for prevention, but that doesn't mean it has to be youth, right? So, so I'm not aware of anything focused like that. The education money, which is going to states and local education authorities, is going to be focused on youth, right? Because that's school-based money, and that's billions. So those are our focus. But of the block grant dollars, particularly the mental health block grant, there is a set aside for crisis services in those, and that could be youth or adult. And there is a set aside for early episode psychosis programs. So that is set aside for young adults generally who experience the first episode of psychosis. So those set asides are within those, but those are the only ones I'm aware of.
Great. Next question is from Brian Huckins. We were talking about the FMAP. How long will that match last?
I think you meant the mobile crisis. I was following the chat. If that's the one, it's 3 years that the 85% FMAP would, the state would be able to get that. So it is limited. It was in a reconciliation bill, which I am not going to go into reconciliation because we could be here all day, but it is a very specific procedure and it has limitations. And one of the limitations is, you'll get only a few years. So it isn't forever that you get that higher FMAP, and that, is something states will look at. But, if you think about 988, they have to implement it. So, it is an opportunity for them to get a little bit more money while they do so for a certain defined time period. Great.
And Karen, this may be for you, but Mary, either one of you, I know Karen, you work a lot on the peer part. So with some of this peer legislation that's coming through, we as the Federation are a little concerned because the way the language is written, it's a bit exclusionary of parent and family peers. It indicates, and I know some of us have talked about this, that a peer has lived experience. And I know that's not a deliberate exclusion, but we're concerned about that because, as you know, our parent and family peers their experience may be lived, but it may also be coming through their child. And we consider that parenting lived experience. What's your advice to us as these bills are coming up? How do we ensure that the language is not exclusionary?
So one of the things that I have, been learning about family peers is the importance of having the support system for even the person that might be a guardian or parent of someone else. And so in our priority bill, the PEERS Act, that's obviously focused on older Americans. So most likely they wouldn't need or have a family peer that's involved in their care. However, we do think it's important that family peer services are available and out there. I think with data and research, we'd be able to share that with policymakers and let them know that, okay, there's also these types of peers out there too that might be working in community settings. They might be working in clinical settings, but we can do some more, I think, education around how family peers are helping, and then ensure, statutes reflect that important intervention. Another thing, and I saw this in the chat, is about youth peers. And youth peers are so important as well. However, have to be 18 for certain liability issues for them to be working with young people. And I think that kind of limits the age group from like 18 to 25 or so for youth peer support. But we actually support it being an intervention that's recognized by CMS and SAMHSA and Children's Family Bureau, and same thing with family peer support. We would certainly be in favor. I think we'd have to probably come up with a larger kind of framework for all of the types of peers and interventions that that need to be supported, and probably in maybe a next iteration of a bill we could do that.
Yeah, and I just want to clarify that the current PEERS Act that Karen was talking about is a Medicare bill only. So it doesn't affect Medicaid, it is only Medicare, and it is only in integrated settings. So those are typically in large primary care practices where a peer might be part of a care team. So that's the only context for that particular bill. And the reason is that we were told by staff to begin there. So a lot of times in Medicare, you have to begin very, very narrow, and then you can build from there, but you have to kind of get a victory with the most narrow, and then they see that that isn't as frightening as they originally think, and then you can build from there. So just want to, let people know that it is a first step, but it's important to get the first step. And it is only in Medicare, which, as Karen said, is primarily, thought about in terms of older Americans.
With the virtual peer support bill that you were speaking about earlier, is it too late for us to have any impact to be explicitly inclusionary of family peers?
That bill has been introduced already, but if there are people or organizations that have a presence in Nevada, the bill sponsors state, it is absolutely important that you weigh in, and never too late. These bills are always being worked on and changed, and so hopefully it passes, but the bill is, there's always room for input until the very end.
Until the very end.
And I believe that's just in the Senate. I don't even think it has a House companion, right?
Yeah, so, if someone were interested in trying to get the bill introduced in the House and wanted to spearhead or lead that effort, then you could certainly, take the Senate language and suggest some changes to it to a potential House sponsor.
So our affiliates could actually take that up and begin to express that to their senators.
Yes, the Depression and Bipolar Support Alliance is the lead organization. I would, certainly work in coalition with them. They probably already have the contacts and may have some strategy outlined for who they would want to pitch the bill to first in the House. So I certainly think it's worth teaming up with them to suggest changes and get another bill introduced in the House.
And I know you guys are following the chat. Karen, our state exec from Nevada, is on with us today, and we're going to put our heads together about how to. So we will see if we can come up with some ways to help to influence this to move forward. I want to just ask a couple of general questions, Mary and Karen, and just get some of your guidance. Many of our affiliates they're warriors on this. They have been doing this forever, but we have some newer chapters and folks who are learning how to advocate in the legislative space. I would just love for you to spend a few minutes giving them some tips, some guidance, maybe some lessons learned?
Sure. This is my favorite thing to do, is to help people understand how to get involved in the legislative process. And, I think it's so wonderful, and it takes an extra step of courage to do that. The first thing I would do is, you just look up who your representation is. So that's on house.gov, senate.gov, or if you're looking at state legislators, you go to your state legislature's website and look up who your representation is based on your zip code. Those congressional and legislative districts are redrawn every so often, so you have to check and make sure who your member is. But then once you find out who that person is, do a little background research and browse their website. I usually go to their press statements and see what have they made statements on, because whatever they make statements on, that's what's most important to them. What do they post on their Twitter or their Instagram or their Facebook account? Those are the things that are priority to them, that they're leading on, that they want to go on record about. And if there's something that you think is missing from that kind of dialogue or media that they're putting out, or if there's something you connect to, send an email and leave a voicemail, let them know that you'd like to speak with them, and lay your issues out, lay your perspective out. For the most part, you'll be speaking with their staff, unless it's at the state level, you're more likely to get a member meeting. But as you think about what to pitch to them first, it's really just introducing yourself and your organization and your work. It's, here's how many people we serve. It's, at one point it would be, would you like to come take a tour of where we are in the community and what we're doing? Now they may or may not be a little reluctant to do that. However, it's, here, let me introduce you to us and share what's important to us. And then from there, having your story or your ask. Your story is maybe your 30-second pitch for why this issue matters to you. And then your ask is, well, this is what I want you to do about it. I want you to vote for additional funding investment, or I want you to vote against a measure that would harm our people. And this is how many people that are affected. These are how many employees we're jobs are a really important thing in the districts. So if people will lose jobs, that's an important sticking point. And then finally doing the follow-up. And the follow-up is an email or a phone call, checking in and saying, hey, I really want to make sure you heard what I said. Here's, a couple of things that I referenced in our meeting, and I wanted to see, is there any action happening on this? Has anything been done? And that follow-up is really important to holding your legislators accountable. So again, that's, just research your representation, introduce yourself, your organization and your issue, tell your 30-second pitch of why this issue matters to you, and then have your ask, and then follow up. Those are the things that I would pitch. And we actually have an advocacy toolkit that we kind of revise every May and release. So we can share that as well. It has all of those little points kind of outlined in a little bit more detail.
And for those of you who are just starting out too, I do want to just mention something called the committee structure. So the way the House and the Senate is organized, they have committees. And every senator sits on different committees, every House member sits on different committees. The people who lead those committees are very important. They have a lot of say in what happens, right? But even the people who are on the committees matter more than the members who are not. So if you're talking about a particular topic, and I'll give you an example, for example, Medicaid, which I know is a big issue for all of us, right? We want to make sure Medicaid is really robust. And actually, I think someone had a question, which I'll try to remember to answer on telehealth and Medicaid. But if you're interested in Medicaid, whether it's telehealth or anything else, it's going to be in the Senate Finance Committee. So if your member is on that committee, boy, that's a place that you really want. When you think about that ask that Karen talked about, like what's your ask? There's a lot of things I must have covered, between Karen and me, we probably covered 15 things today at least, right? What is your ask going to be? It helps to know what committee they're on, because that might be how you figure out to make sure your ask aligns with their committee, because that's even more powerful. You want every senator and every congressman to do certain things, like sponsor a bill. If you're behind the bill, you want them all to sponsor it, and that's an easy ask. If you know they're not sponsoring something that you want them on, that's a good ask. But then at another level of sophistication, if they're on a particular committee, that's always a good thing and a way that you can really help move legislation forward.
And Mary, you wanted to mention something about telehealth?
Yeah, so I think there was a question in the chat about like whether that applied to Medicaid or Medicare. Most of the things that Karen had put up there were Medicare bills. Okay, so those were about Medicare. On Medicaid, it's very much at the state level. They have opened up a lot of the flexibilities, but the issue is what is your state going to do with that? So that becomes more of a state advocacy issue. The bills that we've been talking about primarily are Medicare.
Any final statements? I hate to let you guys go because this has been so informative, but I know we have to. Any final summation statements?
As you know, I'll just leave by saying that what people say and ask for from the states and from outside of Washington very much impacts what happens within the Beltway. So if you are able to mobilize just you to start, that's wonderful. If you're able to mobilize a group of people, that's even better. And if you can move coalitions of groups of people to send the message to DC, whatever your message is, that's even better. So just know that even though, the rest of the country feels very far removed from Congress, in Washington, DC, and it seems like they operate in another universe. It matters back home what people are saying.
Yeah, I would just say that I've been in many meetings, and Karen does an amazing job of bringing some of our advocates in, and you can see the staffers they love that information. They love to hear what's going on the ground. So I know that sometimes you say, does it really matter? If I do this, but it does really, really matter. As a former Hill staffer, I can tell you it makes a big difference. When you hear from someone at home that they care about this, it really registers and you don't forget that. So we're really thrilled to have this opportunity to have talked with all of you. We really look forward to continuing to work with Linda, Michelle at the national level and with all of you as we go forward in coalition on a lot of these things, and just really appreciated the opportunity to be here with you.
And let me say, first of all, everyone has noticed in the chat box, Michelle has just been filling it up with resources. This information is all available on our website. You have Mental Health America's website. We're all in this together. This is our mental health advocacy community. And to that end, Mary and Karen, I know what a busy week you have because you guys are very busy with mental health awareness activities also. We thank you so much for being here with us. We thank you for this sort of collegial partnership. We're all better when we're together. So thank you so much for bringing this to us today.
Thank you so much. It was a pleasure. Have a great rest of your meeting.
Enjoy the rest of the meeting.